My name is Jamie Gillespie. Welcome to Deliverable 5, Advanced Examination Skills. Today I'm going to talk to you about the steps and equipment I need to prepare myself and my patient to perform the comprehensive health examination. First step is organization, providing a safe environment with adequate lighting, providing patient comfort and privacy, using universal precautions on every patient, and appropriate protective personal equipment if the patient's on precautions, appropriate positioning, limiting these position changes, developing the scope of the exam. Today's exam is a well-child visit. The equipment I will need an ophthalmoscope, otoscope, tongue depressor, tape measure, a scale for weight, thermometer, watch with the second hand, sphygmomanometer, stethoscope, visual acuity card, reflex hammer, gloves, and any lab equipment if labs are indicated. The exam is going to include inspection, palpation, percussion, and auscultation. And then the last part of the exam is summary and documenting of our findings and recommendations. So Allie, I would like to start with general survey. We'll take a set of vital signs, including height and weight. We will be doing a visual acuity formally with the Snelling chart. And then the exam, we're gonna go from head to toe. So I'm gonna start by looking at the top of your head, going all the way down to the tips of your toes. Does that sound okay?
Yes.
And would you like your mom in here for the exam, or would you like her to step out?
She can step out.
Sure. All right. Mom's gonna go take a walk. So, let's start with looking in your hair. I'm gonna start by inspecting your hair. So wash my hands first. Put on some gloves. Your hair. Any problems with your scalp or your hair?
No.
I'm looking for any lesions, scars, infestations, sores, flaky skin. Oh, looks very good. Hair is very healthy. Skin, you raise your eyebrows, follow your cheeks. Circle your tongue. All right, close your eyes. Don't let me open them. Bite down. Good. Open your mouth and shut. And then let's look at your eyes. Look at your eyes. All right, just look forward. Forward. Test for accommodation. Good. Round, equal, reactive to a light, and they accommodate. Can you follow my finger? Don't move your head. Good. Conjugate, no strabismus. Good. And just look up for me. Sclera is white, supple, no dryness. Conjunctiva is pink. Good. No lesions. Any pain? Pain, no sinus pain?
No.
Oh, here.
No pain.
Good. Next, I'm going to look in your nose. Any bats in the cave? Huh?
No.
No. Good. And the septum is midline. No drainage. No tenderness. Now let's look in your mouth. Select your teeth. And grab my tongue depressor. Stick that tongue all the way out. Good. Tongue is midline. Mucosa is pink and moist. No lesions. Any pain in your mouth? Let's see on your tongue. Lift it up. Good. Looks good. Teeth are intact. No missing teeth. And then the throat. No redness. No pain. No white patches. Tonsils are intact. Okay. Next, I'm just gonna feel your lymph nodes. Is it tickle? Oh, tickle, tickle. Very good. Just gonna feel your thyroid in the back. Thyroid's not palpable. Can you swallow for me? Good. I'm just going to check your carotid pulse. Very good. And the other side. Good. Any pain in your neck?
No.
Can you look down? All the way, chin to the chest. There you go. How about up? And then left and right. No problems with that. Next, we're going to look at those ears. Okay, we're gonna, for children, we usually pull down and back. Adults are up and back. So you're still a child. So we're gonna go down and back. Oh, and I see the tympanic membrane is normal. No impactions. Any pain when I press on my trays? Have you had any hearing problems?
No.
Put this right in here. Oh, I can see all the way through. All right. I'm gonna whisper something. You tell me what I say.
Puppy. Elephant.
Good. Good. And next, I would like to let's look at your arms next. Any pain in your arms?
No.
Start with inspection. Skin is warm, pink, and dry. Does it hurt when I press anywhere?
No.
Pow. Good range of motion. Can you make a fist for me? Good. And just relax. Breaking pulse. No clubbing. Capillary refill less than 1 second. Let's look at the other arm. Gonna make a fist for me. Good. No discoloration. No concerns. Any numbness? Does this feel the same on both sides? Does one side feel different than the other?
No, they feel the same.
Good. Any pain?
No.
Yeah. I'm gonna look in the arm. Actually, let's lay you back if you don't mind. Oops.
Sorry.
Whoopsies. All right, just lay back and relax. Making sure my patient's comfortable. Are you warm enough?
Yeah.
All right, let's start with the underarms. And start with inspection. Looks good. Palpation. Oh, I don't mean to tickle you. And the other side. No masses, no lymph nodes. A little ticklish.
Yeah.
All right. Go down to your tummy. Start with inspection. Flat. No scars. Have you ever had surgery on your tummy?
No.
We're going to use my diaphragm here. Making sure my stethoscope is clean and it's not all 4 quadrants. Listen to that tummy. Ooh, I think I heard your lunch. And we'll switch to the bell. Listen for any bruise. Down the aorta and the renal. Nope. Ooh, ticklish again. Okay, just relax.
Okay.
Okay, here. How about here? If I go deeper.
Not really. No pain.
Normal? Normal?
Yep.
And then last, I'm gonna, got that out of the way, we're gonna look at the chest. Any pain? We're symmetric, no discolorations. Nipples were 10 or 1 in development. Have we had any discharge from the nipples at all?
No.
Any pain? Okay. Wonderful. Next, I'm gonna look at your legs. Give you a postie. I can't look at your legs very well, can I? All right. We're just gonna first by inspecting all the legs. She's fully undressed, so there's no discoloration. I see no bruising. No swelling. I'll get the pulses. So relax that knee. So we can feel that. And pulses are equal. Any numbness in your legs at all?
No.
Any pain? Any pain when I press on them? And then the toes, can you wiggle both toes? Can you press down? Press down like you're pulling on the pedal, both of them. All right, pull up. Good. All right, checking your Babinski. Oh, that's my favorite one. All right, we got good capillary refill. Hey, silly. There we go. That part's all over. I'm gonna have you, can you raise your leg up? For a full 5 seconds, very good. And now the other leg. Good. Now I want you to take your leg, run your heel down your shin for me. Good. And the other leg? Very good. And then before we stand up, is it okay if I just look at your private parts to make sure that they're healthy?
Mm-hmm.
Okay, so we're gonna put on the underwear, we're gonna inspect for any discoloration, laceration, swelling, any lesions. Have you had your period yet?
No.
Okay. Any problems or discharge?
A little bit of discharge.
A little bit of discharge. What color is it?
Clear.
Clear. Okay. How often do you have that? Would you say every day?
I'd say so, like every day or every couple days.
A little bit or a lot of it?
Just depends.
Okay. Have you had have you had any sexual intercourse?
No.
Okay. And I just want to let you know that any type of questions like that, it's just between me and you. I won't tell your mom unless I have your permission. Okay.
Mm-hmm.
Any concerns about needing birth control or
No.
protection like that? Okay. Well, if you ever do, you can always get that and that type of care without your mom. Okay.
Mm-hmm.
Okay. Okay. So I would like to sit you up. Okay. I'm gonna look at your back. Sit forward, please. Okay. I'm gonna look at your back. We're gonna inspect. Go ahead and stand up for me if you don't mind. Can you touch your toes? Good. Just making sure your spine's nice and straight. Any pain with that?
No.
Good. No, there's no lateral movement of the spine, and good. Can you walk from heel to toe? Good. All right. Let's sit back down. And now listen to your chest again, the diaphragm. Deep breath. And out. In 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 and out. Okay. Let's cap on here. Any pain right here?
No.
Tap on you?
No.
And we're gonna do the same to the other side. And then pain when I tap right here. And next I'm gonna lean you back. Still got my stethoscope out. Listen to your heart sounds. Yes, breathe normal. Take a deep breath. Good. Your lung sounds are clear. Do you ever get short of breath or wheezy when you run at all?
No.
And then last thing, can you touch your fingers? Very good. And then touch my finger, touch your nose, and back and forth. Other hand?
Oh,
Okay. That is one more thing. Scoot forward. Just texture reflexes. I'm going to have you pull your fingers. Try to pull as hard as you can, hard as you can. Bonk. All right, that is all. Do you have any questions about what we did?
Nope.
Any concerns or things we didn't talk about? So I've got Allie Gillespie here. She's an 11-year-old female. She's presented today with a well-child checkup with her mother. We have a height of 4'10", weight is 90 pounds, BMI is 18.8, little underweight, but not concerning. She's about 10% on the gross scale. Blood pressure is 100/70, heart rate is 80, respirations are 16, temperature is 98.6, and her visual acuity was 20/20. No concerns with hearing. Skin's warm, pink, and dry, no lesions, rashes, or bruises throughout, normal hair distribution. The head hair is normal texture, scalp is without lesions, normal cephalic, sclera is white, conjunctiva pink, pupils are equal, round, reactive to light and accommodation, gaze is conjugate, disc margins are sharp, no hemorrhages or exudates. Ear canals are clear, tympanic membrane with a good cone of light, and no hearing deficits. Nose, the mucosa was pink, septum midnight, and no sinus tenderness. Oral mucosa is pink, dentition was good. Tongue is midline, tonsils were present and normal. No redness or pain, no swelling, no white patches on the throat. Neck is supple, trachea is midline, thyroid's not palpable. No cervical, axillary, epitrochlear, we did the posttrabecular and submandibular lymph nodes as well. None palpable, no tenderness. Thorax and lungs. Thorax is symmetric at exertion. Lungs are resonant on percussion. Lung sounds vesicular with no abnormal sounds. Cardiovascular, the health sounds were normal. No murmurs, no extra sounds. Rhythms regular. Apical pulse was palpable. No bruise and breast capillary refill with outflow extremities. Breast development, we have Tanner 1. They are symmetric. No masses, no tenderness, no nipple discharge. Abdomen is flat, soft, and non-tender. No sounds. Bowel sounds are active. Genitalia, vulva was without lesions, masses, or trauma. Internal exam was deferred as a no indication. She's pre-menarche, not sexually active. At this time, extremities are warm pink without edema. No deformities or discolorations. No tenderness. Peripheral vascular capillary refill is within normal limits in all extremities. CMS is intact throughout. Pulses are +2 throughout. Musculoskeletal, no joint deformities. Swelling or tenderness, range of motion is within normal limits in all joints. No spinal lateral deformities, no leg bowing. Gait is normal and brisk. Neurological mental status is alert and cooperative, follows commands. Good muscle bulk and tone. No weakness, numbness, or ataxia. And the patella reflexes are normal. And that concludes our comprehensive health examination. Thank you, Allie.